Hello everyone, let us understand cardiac cycle. This topic we will be covering from NCERT, NEET point, every point we will be trying to cover it, and it's very important. And if you understand the concept, I'm assuring you will not miss any question from this topic. To understand this cardiac cycle, which is of 0.8 second, what are the steps? How the time is divided? If you see zero point 0.1 second atria systole, zero point 0.3 second ventricle systole. Systole means they are contraction. Atria is contracting, atria systole. When ventricle is contracting, ventricle systole. And when both are relaxing, we say that is a relaxation period of 0.4 second. So we can make a diagram this way. Make this diagram, and it's very important NEET question also. This is the time for atria systole 0.1 second. This is the time for ventricle systole 0.3 second. And this is for joint diastole 0.4 second. So total time is 0.8 second. One cardiac cycle takes 0.8 second. Now we'll study one by one. Now see atria systole means atria has to contract. Systole means atria will contract. When atria will contract, all the blood which is present in the atria will be poured into the ventricle. So inside the atria pressure will increase, and inside the ventricle blood volume will also increase. Is it clear? So if you see here, pressure in the atria has increased. Check, the pressure in the atria has increased, and volume in the ventricle has also increased. It has reached to 130 ml. But what is the status of the valve? Valve's status is only AV valves are open, means bicuspid and tricuspid valves are only open, but aortic valve and pulmonary valve means semilunar valves are closed. So in atria systole, atria is contracting, blood is poured into the ventricle, so ventricle volume will increase. Inside the ventricle, blood volume will increase. Clear? And what is the status of the valve? You will find only AV valves are open, semilunar valves are closed. Atria contract to increase the blood flow by 30%, because 70% blood is going passively, means 2/3 blood is already reached to the ventricle by passively, and only for the 1/3 the atria is going for contraction. Now ventricle, the moment ventricles start contraction, the contraction means they are decreasing the volume. The moment they decrease the volume, obviously ventricle pressure is increasing. Understand, this is a concept, please focus, okay? Ventricle pressure is increasing, and this blue line is for ventricle. When ventricle pressure is more than the atria pressure, right now at this point, when the ventricle pressure is more than the atria pressure, what will happen? The AV valve close. AV valve has closed, and inside the ventricle, see, pressure is increasing, it is increasing, but volume is not changing. Volume is not changing. We say isovolumetric, means volume is same, and though their contraction is going on but volume is not changing, we say isovolumetric contraction. In this stage, all four valves are closed. This is the stage, you can see this is a very good diagram, please highlight it. This is a stage where all four valves are closed. AV already has closed because the ventricle pressure is increasing, but semilunar valve has not opened till now. We say it is actual duration is only 0.05 second. From 0.1, okay, from 0.1, this much only, fractions of second. If we say it is a state where all four valves are closed and volume of the ventricle blood is not changing, volume is constant, we say isovolumetric, but inside the ventricle pressure is increasing. Now because of that increased pressure, you can see this diagram, all the four valves are closed. Now because of the increase in the pressure, what will happen? A stage will come when ventricle pressure will more than the pressure of the artery. It is pressure is more than the pressure of the artery, you can see here. Now it is what it is doing, it is making the semilunar valve open. This is the point where the semilunar valve open. Once again, when the ventricles start contracting, means volume decrease, pressure increase. Initially when they start contracting, first AV valve close. Clear? When more pressure is created. More pressure is created because of that pressure, and pressure should be more than the artery pressure, okay, more than the artery. What will happen then? Semilunar valve will open and the blood is ejected. We say ventricle ejection, means blood is ejected into the respected trunks. Now see here, you can see this blood is ejected into the respected trunk, pulmonary artery and dorsal aorta. And what will happen? The volume in the ventricle is left. That volume of the blood is known as now end diastole volume. The amount of the blood which is left after the systole, that is known as end diastole volume. Clear? And that, if you see carefully, the value is coming nearly to the, you can say it will come nearly 40 or 50 around it will come. So this is the way. When beginning, what was the pressure? This was known as end diastolic volume. This was known as end diastolic, means now the diastole is over, now it has to start systole. So end diastolic volume was 130 ml, and end systolic volume is nearly, you can say, 50 ml or 40 ml, you can say 50 or 40 ml it is. I'm writing it 50 ml. So this is the ventricular systole for 0.3 second. Now, isovolumetric relaxation. When the ventricles start relaxing, what will happen? The pressure in the ventricle. See, this is the, I'm focusing this color. Okay, please focus. This is the blue color. Blue line is for the ventricle. When the pressure in the ventricle decreases, when the pressure in the ventricle decreases and it start decreasing, when its pressure become less than the artery pressure, when its pressure become less than the artery pressure, at this point, what will happen? At this point, your semilunar valve close. Semilunar valve close. Clear? Semilunar valve close at this point. This is the point given here. They are trying to match with this. Okay, semilunar valve close at the circle which I have highlighted it. And still, if you see, the volume in the ventricle blood is not changing. Volume is same. We say this is known as isovolumetric relaxation. Now, after this, what will happen? Because the ventricles are in the isovolumetric relaxation, all the four valves are closed. Now, atria was already receiving the blood from the superior and inferior vena cava and from the pulmonary vein. Slowly, 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 when the ventricle pressure is less and the atria pressure is increasing. At this point, if you see, I'll highlight with this color. When we find, when the pressure difference is there, when the atria pressure is high as compared to the ventricle, at this time the cuspid valves open. Bicuspid, tricuspid open, and the ventricle again start filling. That is passive filling of the ventricle has started. Is it clear? So at this point, what happens? Semilunar valve is closed, but your cuspid valve, AV valves are open. See this flow? It is very interesting and very helpful for learning. So 0.1 second atria systole, the entire blood is coming into the ventricle. Clear? Entire blood is coming into the ventricle. You can see this diagram carefully. Now, at the beginning of the ventricle systole, all four valves are closed. See carefully. Now the blood cannot go back. Check. It cannot go back into the atria, and semilunar has not opened till now. We say this is isovolumetric contraction. Now after this, what will happen? Ventricle ejection. Means next stage is when the pressure increases more, semilunar valve are forced open and the blood is ejected into the respective trunks. Now during the relaxation, immediately when the ventricle starts relaxing, check in the diagram, semilunar valve has closed. Semilunar valve has closed and volume is not changing. We say isovolumetric relaxation. Because the atria, upper chamber, were already receiving the blood from the superior vena cava, inferior vena cava, and from pulmonary vein. So blood is already coming. So now what happened in the next? The AV valve open. You can see this AV valves have opened and the blood from the atria has entered into the ventricle. So this is the short summary for the cardiac cycle. Now see next. Already we have discussed this. This red color, please focus, this red color is for the ventricle pressure. and especially we are focusing with the left ventricle, which is going to supply blood to the entire body. At this point, when the pressure is more than the atria pressure, when the pressure is more than the atria, your cuspid valve close. And when the pressure is more than the artery, okay, more than the artery, then aortic valve open. And when the pressure start decreasing, it is less than the artery. At this time, the aortic valve close, means semilunar valve close. And when its ventricle pressure is decreasing more than the upper atria chamber, at this time the bicuspid valve open. So this is the one diagram to learn how the pressure difference is responsible for cardiac cycle. Understand carefully. The valve opening and closing, if you see, you know basic. Valves do not have muscles. They are passive doors and they are generally operated entirely only by the pressure gradient. So from this you can learn it. Ventricle systole is very important. At the beginning of ventricle systole, cuspid valve will close. At the then sequence, first cuspid valve will close and then semilunar valve open. And when the ventricle systole is at the end, then your semilunar valve close, and what will happen? Your cuspid valve will open. Please focus, this is very, very, very important. So when the cuspid valve is closed, you will hear a sound. That sound is known as lub. First hard sound because of the closure of AV valve, which is at the starting of the systole. And at the end of the systole is over. Now you will hear the second hard sound because now the semilunar valve are closing. We say dub sound. So semilunar valve is closing means end of the systole, or you can say starting of the ventricle diastole. We know hard sounds are not muscle reflexing. They are generally physical sounds coming because of the shutting of the valves. Closing of the valves will create sound, not opening. Closing, please focus, it is a closing of the valve which will create sound. The summary, if you see, this is very nice summary. Bicuspid valve is always open during the atrial contraction. Clear? And your semilunar valve, means aortic valve, is open at the time of ventricle ejection. Clear? So bicuspid is open at the time of atrial contraction and during ventricle filling. And semilunar valve is open only at the time of ventricle ejection. And if you see during isovolumetric contraction or during isovolumetric relaxation, check both the sides valves are closed. It is closed. Volume is not changing during that time. Volume is not changing during that time. Is it clear? They are the only fractions of second where the heart act as a complete sealed vault. Both valves are closed. AV valve and semilunar valves are closed. So it is very important. I hope so it might be now easy for you. So end diastolic means now the beginning of the systole, or you can say end of the diastole. End of the diastole of the ventricle. Volume which is present here, that is 130. Roughly you can say 130. And this one, when the systole is over, then end systolic volume. Is it clear? So end diastolic volume means at the beginning of the systole, and systolic means at the end of the systole. Now see here. This is your end diastolic volume 130 ml. Systolic volume is 60. So it means how much is ejected out? Only 70 ml. That is known as stroke volume. So end diastolic volume is 130. Systolic is 60. So how much is ejected out? 70. That is your stroke volume. One more presentation. This is your end diastolic volume. This is your end systolic volume. And this is your stroke volume. So this is the end diastolic volume minus systolic volume will give you the stroke volume is ejected out per beat. Now see, this is a summary. Right now we discussed already, we know okay, here if you see carefully, this is the point where your cuspid valve will get close. And when they get close, the first hard sound is your lub sound. And the volume of the blood which is reached here, it is known as end diastolic volume. Means now the ventricle is ready for the ejection. Now when the pressure increase more, what will happen here? Your aortic valve open. At this point the aortic valve open and blood is ejected. Ventricle ejection, blood is ejected. And now when the pressure start decreasing, at this point your semilunar valve get close. And when the pressure decreases more, when the semilunar valve close, you get a sound, second sound, that is known as dub sound. So please focus, the first sound lub is because of the closure of AV valve, and dub sound is because of the closure of semilunar valve. The two sound is there, one is lub sound at the beginning of the systole, dub sound is at the end of the systole. Clear? And the amount of the blood which is left even after this, that is known as end systolic volume. So it means how much blood is ejected, that is known as stroke volume, which is 70 ml. I hope so this video might be helpful for you. Thanks for watching, and if you have any other queries, please mention in the comment. I'll try to help you out.